Hello and welcome. See, folks are just starting to join us, trickling into the room. So happy to see you with us today. Welcome, folks. Hopefully you are here for starting the conversation, talking about youth mental health with these wonderful panelists. While you're joining, coming into the room, please feel free to get to know each other, introduce yourselves. Please feel free to share your name and your pronouns if you'd like to, where you're joining us from today. And we want to root today in joy as well. So if you don't mind sharing something that's been bringing you joy lately, we'd love to hear that too. We'll get started in just a moment. This is where we're headed today, folks. Please share a little bit about yourselves in the chat. We're in welcome stage. We're going to get started with a little bit of an introduction, sharing some resources just to get started, and then we'll move into hearing from our presenters today about their experiences with youth mental health and lessons they've learned along the way. We'll also have plenty of time for Q&A with the panel, as well as a short closing and survey. But while folks are beginning to share out in the chat and let us know a little bit about who's in the room, I'm hoping that we can bring everybody's voice into the room and get to know our panelists a little bit as well. So folks, would you mind answering for yourselves those couple of questions, name, pronouns if you'd like to share, where you're joining us from, and something that's been bringing you joy lately? Maybe we'll go in order on the screen. Micah, can we start with you?
Sure. Hi. I'm Micah Fink. I'm a journalist and a podcaster, and very happy to have you all here with us tonight.
My name is Sydney Fink. My pronouns are they, them. We're based in New Jersey, and something that brings me joy is playing the bassoon in my state orchestra.
Love that.
All right, looks like I'm up next. My name is Laura Erickson-Schroth. I use she or they pronouns. I'm the chief medical officer at the Jed Foundation, and I'm a psychiatrist. And I'm joining from Brooklyn, New York. And something that brings me joy is this weekend, Prospect Park was filled with people, and it was just a really nice, wonderful experience. And I just, got an ice cream from the Mr. Softy and hung out in the park.
I think I'm up next. I am Chase McCullum. I'm a school psychologist in Mississippi. I'm currently in the city of New Orleans, so actually the food in New Orleans brings me joy. But ice cream, now that I have ice cream in my brain, now that I'm thinking about that as well. So I'm really excited to be here, and I really am excited to just really talk about how we can support kids.
Thank you all so much. And thank you to folks who told us that not everybody was able to share in the chat. So you should now be enabled to do that. My name is Hannah, pronouns they, them. I'm joining from Virginia Beach, Virginia today, usually based in DC. Something that's bringing me joy right now is I'm on a wavelength with Dr. McCullum and thinking about the glorious blackberry season that we're in. And we are also here today with Marielle, also on the Pulitzer Center team.
Hi, everyone. My name is Marielle. My pronouns are she, hers. Following the food theme, something that brought me joy today was getting to eat some Korean pastries that my sister brought. So that brought me a lot of happiness.
Amazing. Thank you all for being with us and beginning to share in the chat. Hello in Alabama, and please keep getting to know each other that way. Our number one goal for our time together today is to take care of ourselves and each other, whatever other learning and work we might be doing. So just a reminder, if you or someone you know needs to talk to someone right now, please text, call, or chat There are resources out there for you. Today, we are going to be digging into mental health, suicide prevention, and harm reduction. So these can be challenging topics. As we're wrestling with those together, please take care of yourself, take breaks, be kind to yourself, come with a glass of water, do whatever you need to do to make this a safe and comfortable space for yourself. We are in Zoom webinar today, a very familiar space for most of us now. But just a reminder, we won't be able to see and hear participants in the room today, but we can be responsive to each other by using the Q&A to share questions you want to ask the panelists after their presentations, and the chat box anytime you want to share responses, reflections, or resources with everybody in the room. So we're going to get started with a short introduction to what brings us together today before we get into the specific conversations with our panelists. So Marielle and I are coming from the Pulitzer Center, which is a journalism organization based in Washington, D.C., and with staff, journalists, educators we work with all over the world. And as a journalism organization, we cover many different underreported issues. These are just a small sample of the kinds of issues that you'll find in the reporting on our website. And our hope is that with the reporting that we do, the in-depth nature of that reporting will help to inspire action on difficult and complex systemic global problems that our communities are facing. We also acknowledge and want to make sure that, that sometimes there are barriers to accessing this kind of information. Particularly in our K-12 world, we know that students tell us that they feel more knowledgeable and more prepared to take action and empowered in their own communities when they're following the news. There are a lot of obstacles to doing that. A lot of students report feeling sad, angry, and afraid when they encounter news. Maybe some of us can relate to some of those feelings, and also that they don't feel well represented by the media that they're seeing on a day-to-day basis, or that the news isn't covering the issues that matter most to them. So our hope with our journalism at the Pulitzer Center and the education programs that we run is that we can move from news being something that makes us feel smart or knowledgeable, but also brings up all of these negative and sometimes disempowering emotions that might lead us to hopelessness, to thinking about how we can take action and how we can use that information for good in our own lives and in our communities. So our goal at the K-12 education team is to create programs and resources that cultivate a more curious, informed, empathetic, and engaged public by connecting teachers and students with underreported global news stories and the journalists who cover them through events like this one today. So the project bringing us all together is Conversations with Sydney, a new podcast for which we created a listening guide. There are 4 episodes out now, most places that you listen to podcasts. And we're really happy to be able to provide a listening guide that contains guiding questions for educators and all those who are working closely with youth to think deeply about what their own experiences with mental health have been, what it looks like to have productive conversations around youth mental health, and how to responsibly take that into their classrooms and all those spaces where they're working with young people. So as we're getting started today, we just want to do a quick temperature check and check in with all of you in the room. We asked a little bit about your backgrounds when you were registering, and learned that some of you are mental health professionals yourselves, while others are parents or educators coming in with many different kinds of experiences. So we'd love to know, how equipped do you already feel to talk about mental health with the young people in your lives, however you would define that. So please take a moment. We'll just leave about 5 seconds for you to consider, get your answer in, and we'll see what our group is feeling like today. Also acknowledge this might change on a day-to-day basis, how equipped you're feeling at the moment. We'll close out that poll in 3, 2, 1. Hopefully you should be able to see those results on your screen, but it's a pretty wide spectrum. Most people, our plurality said, feeling somewhat equipped, but we have a wide spectrum all over the place. So if you're somebody who feels very well equipped or anywhere along that spectrum, but have had experiences that you want to share, please use that chat to make sure that this is a collaborative experience where you can bring that knowledge into the room. And we hope that if you're in that space of feeling somewhat unequipped, very unequipped, or not sure, neutral, that today's conversation can move the needle a little bit and help you to get some of your questions answered. So with that, I am excited to turn things over to our fabulous panelists who we're going to hear from in short presentations and then have plenty of time for a Q&A with afterward. So thank you all so much for joining us. And we are going to start with Micah and Sydney, the Finks and the co-hosts of the Conversations with Sydney podcast. So folks, I am hoping that you could start us off by telling us a little bit about what led you to create this podcast together and what you hope to accomplish with that work.
Sure. Let me just jump in. I didn't say my pronouns, I, he, him, and the thing that gives me joy is working with Sydney. I
think the podcast started probably 2 years ago when I came home from school. I was a sophomore. I'm a junior now in high school, but I came home from school, and at dinner when I asked my parents, like, if it was normal for my friends to be talking about suicide, because I was worried that a lot of them might not graduate high school just because they wouldn't live to see senior year. And we just didn't, my parents just didn't know what to do about it.
Yeah, I didn't even know if you should talk to kids about suicide. It seemed like, I like many, I think, fall prey to that myth that says that if you talk to your kids about suicide, it'll increase their thinking about it. And one of the things that we've discovered almost right off the bat was that that's entirely wrong. And that by talking about these questions, it creates space and it creates the opportunity for more conversation. And, interestingly, when Sydney started this conversation, they were talking about their friends. And it took a while for us to realize that they were also themselves struggling with some of these issues. And so I think, how kids test the waters with their parents is pretty important. And then also how parents respond. If you've heard some of the podcasts, that's one of the topics we've heard over and over again from real experts like Laura and others, that how you respond to your kids raising these questions is huge, because you'll either open up a conversation or shut it down. And again, how prepared was I? Totally unprepared. How prepared am I now? Getting a little bit better, I hope.
Yeah, but we're trying to find, we have a lot of questions. I had questions, my parents had questions, and I think we just want to try to find the answers and share them as widely as we can to help people who are also uncertain with how to deal with it.
Yeah, I guess the last thing I'd say is just for me as a parent, I'm a journalist. I went online, I did a lot of searching around, and I really didn't find anything that was terribly helpful for me as a parent dealing with a kid who was thinking about suicide or even talking about suicide. And I can only imagine there must be, the numbers are huge. I think more than 20% of American high school kids now actively thought about committing suicide last year or in the last year. Yeah. And that means, I guess, 20% of parents out there, or some percentage, have kids who are thinking about this, or even more so. And so I think we all have to be prepared if we want to protect the things that are most people, that are most meaningful to us, really. That's where it came from.
Thank you so much. And your podcast is an interesting reflection of that journey, right? And in some ways, it's a documentation in the past, a reflection on the kinds of conversations that you had already been having together. And in other ways, it's an exploration where you're learning on the spot with the experts and the people who you're talking to, the other teenagers who you're interviewing for this project as well. So I'd love to know a little bit about, through the process of creating this podcast, what some of the most important things that you learned were. What are some of those major themes that you want other people to know that show up in that podcast?
I think for me, at least, one of the big things was that suicide is not only preventable, but it's also sort of easily preventable. Like if you know if you don't try to just be the therapy friend, if you're a kid whose friends are dealing with it, or it's a problem that has a solution, and that has a solution that's easily accessible if you know where to go. I think just most people don't know where to go. And by that, I'm referring to either 988 hotlines or therapists or places where you can get help with people who are trained in suicide prevention. But
yeah, and I'd throw in, I'm not so sure how easy it is to prevent suicide, but I think there are definitely things one can do. And the success rates are very, very high if you do them.
yeah, I mean, I didn't mean easy, just
Yeah.
in one of the episodes, we discussed how for people who are very close or like in the moment considering dying by suicide, if they reach out and find help in 10 minutes, they can be talked out of it over text or over a call from a helpline, from a hotline. So
yeah, no, so that's really important. And for me, I think, there've been so many big takeaways from a parent's perspective, how you react when a kid raises these topics, and that it's not about you, and it's not about your parenting, it's about the kid. That was a huge one. Another one, Sydney was mentioning how effective the helpline is for people who are in crisis. It can't solve your problems immediately, but it can certainly keep you from an act of desperation, which is so important. I'm surprised also at how willing people are to have these conversations if you begin them. We've seen that with some of the teens we've talked to, also with friends and family members. I'm amazed, since we did the podcast, how many of my close friends and family have said, oh, by the way, I have a cousin, I have an uncle, I have a child, I have a best friend who is struggling with these issues.
And I think that's a big part of it, is that we're trying to open the topic in a manner that's unstigmatized and there's no judgment attached to it. We just want to know, we want to share our story and help other people to also be more comfortable talking about it. And I think people want to talk about it. It's just as in our current society, there's not a lot of space to do that in a healthy way.
Yeah, and that might be a question for Laura. I don't know if she wants to jump in here, but I guess the impression I'm really getting very deeply is that conversation begins the process, but conversation is also part of the process of healing and of finding support and finding other ways to deal with the challenges that face us all.
Yeah, I think you're bringing up something really important. It is sort of part of how you move through things, community, right? Like how we connect with others, how we take in ideas from other people, how we sort of figure out, why am I thinking the thing that I'm thinking, and why is my brain going to this place, and how can I, other people can help bring us other ideas, and help us think about things that we hadn't thought about before, especially when we're in those kind of moments where you get tunnel vision. Yeah, I think that's really, really important.
Thank you, folks. And in addition to some of those substantive takeaways about the kinds of conversations that you had, I'm also curious for both of you. Sydney, you're an artist. Micah, you've been a journalist for many years. Both of you are storytellers. What were some of your takeaways about the power of storytelling and the importance of being responsible in your reporting about mental health from the process of creating this podcast?
I guess something that I've been learning and in the process of figuring out, I think, especially with Jed's help, is that you can really, there's so many things that we can say that could have any sort of impact, but it's really on how we say it and how this information might be available from other sources, but how can we package it so it's most easily accessible to as many people as possible, no matter their attention span or what they're interested or their political alignments or whatever. But yeah, that's just finding what to say and then finding how to package it. And
yeah, and I think for us, it was a discovery that we could do this together. I mean, we were having this conversation together, and then we went to a suicide prevention workshop, and then we went to another one, and this idea that what we were learning was important, and we wished we could. Sydney kept saying that their ideal audience is the sophomores in their school. That it's very personal, that we really want people to be able to relate to this, and I very much believe in the power of personal stories. That's the kind of work I've done for most of my life as a journalist, that in going deeply into somebody's personal story, one can often achieve almost a universal connection, because we're all so profoundly struggling with things all the time. And that's one of the ways that you can make connections. And to me, facts are important, and the framing to be accurate is important. But I think in some ways, these very human first-person voices, and then I think even the experts are people, real people, and they have stories as to why they've come into what they're doing and what they've discovered. And I think if you treat everybody in that way and give them the opportunity to express themselves and tell their stories, that I think it's just, personally, I think it's fascinating. But what we're hearing is that people want to hear from teen voices. They, perhaps even more than parental voices, right? That there's a whole conversation going on, and you don't all that often hear from teens. And the interviews we've done with other teens, Sydney and I together, it's amazing how honest and deep people want to go, and how open they are to talking about these things. They're just waiting for somebody to ask.
And I feel like to go off of that, it's very personal, and it's like the stuff that we're covering. I've been asked a lot, like, how are we comfortable talking about something so personal? But to me, it feels like, since there's so many people who are going through this right now, when in our fourth episode, we do an interview with a teenager who's actually a friend of mine, and we had never talked about this before, but it was just so interesting how many of our experiences were shared, and how many things we both related to. And I think that sort of allows both us together and also other people who we interview to just sort of open up and be honest, like Dad was saying. It's just that it's personal, but it's also shared by so many different people that I think of it at least as we're providing a lens through which people can see a broader population. And I'm not trying to claim that my experiences are representative of everyone, of course not, but I think the more people we can talk to and find, I don't know, a broader range of experiences to represent.
Yeah, and also the last thing I'll add to that is just, as a journalist, and my background is as an investigative reporter, I'm also quite struck by the fact that this is a trend that's increasing over time, and has been increasing now for almost a decade and a half, and that it's getting younger, and it's getting wider, and it's impacting young people. It's also impacting college students. It's also impacting adults. That there's something, while it's always individually expressed, we're all, as a society, experiencing something much larger. And so while it is deeply personal, there are larger forces around us that are, I think, cultivating these problems in some ways. And if you look at the trend lines, they're pretty alarming. And I think that's what takes it for me out of the world of anecdote and into something truly more socially important. Because if you haven't felt it already in your life, maybe it's around you. And all we need to do is, we went to one workshop where they said, if you start looking for the signs of suicide, then you start to see them. But until you even know, until you are aware that they exist and what some of them are, it's almost, you just don't see it. We're somehow accustomed to not seeing these things. Over to you guys.
Thank you folks so much. I want to remind everybody to share your questions in the Q&A, because folks, I have a lot of follow-ups for you, but I'm going to hold off for now. And I've also shared the link to Conversations with Sydney in the chat, where you can hear more of their voices and the experts they've interviewed, the other teens they've talked with about this. But now that we've heard a little bit about your personal experiences discussing mental health as a teenager and as a father, I would love to kick things over to Dr. Laura Erickson-Schroth at the Jed Foundation to contextualize the national landscape of youth mental health a little bit more for us. So thank you so much for being with us as one of the interviewees and experts on Conversations with Sydney, and to your colleagues at the Jed Foundation for their support with this webinar as well.
Thank you so much, Hannah, and thanks, Micah and Sydney, for having me. I am going to try to share my screen. Let's see how this goes. Let's see. I'm going to see if this slideshow works. I'm hoping that worked.
That's great.
Thumbs up. Okay. All right, great. Yeah, so I was asked to give a little bit of a background on, what we know, data trends, that kind of thing. So I'm going to start off. Let's see if we can, there we go. This is me. My name's Laura. I'm a psychiatrist and I'm the chief medical officer at the Jed Foundation. A little bit maybe about why I was interested in doing this. I was just fascinated by this idea of a young person and their parent putting together this kind of podcast together to talk about such real things. I love the idea of intergenerational conversations about these topics. I love that, a lot of times young people are talked at or about rather than talked with. And I loved the idea that Sydney was going to be co-leading this and coming up with the questions and thinking about where they wanted to go. So that was just really exciting to me. My background is I'm a psychiatrist. Like I said, I've always kind of been involved in public health and specifically LGBTQ mental health. And I've also worked in psychiatric emergency rooms for a long time. So I've worked in something like 11 or 12 psychiatric emergency rooms across New York City. So I've seen a variety of different sort of neighborhoods and lots of different presentations of different people, and know a lot about what people look like when they're in crisis. And then I've also worked in a number of LGBTQ clinics. I've been at one called Hetrick Martin Institute, or HMI, for the last 7 years. I've been working there 1 day a week. And that is for young people 13 to 25. And at Jed, where I started about a year ago, our signature programs are working directly with schools and with colleges to help them to assess and then strengthen their mental health and suicide prevention programs. And that's because our founders lost their son, whose name was Jed, to suicide while he was in college. So those are our sort of signature programs that Jed's known for, but we also do a lot of work in, I think, what Micah was talking about in this kind of storytelling. We actually have a part of the organization that's our initiative for storytelling and cultural change. And we think a lot about attitudes and behaviors and how we can get young people talking to each other about, things that are difficult for them, and how we can help adults to know how to talk to young people about these kinds of things. So I actually included in this, I'm hoping it's going to play, I included a video on the next slide that's from our campaign that's called Seize the Awkward. And the idea of this campaign is to help young people to talk to each other about things that are going on in their lives. So I'm going to see if this plays.
Oh, no, it's so sad. You got a roof over your head. Bro, you gotta stop looking at the person. That's what white people think. Los hombres no lloran. All right. You want to talk about it? Thanks for hearing me out, bro. Appreciate it.
Talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
All right. Was everybody able to see that? Sometimes things don't go right in the in the tech part of the show, but yeah, so that's an example of Seize the Awkward is a campaign that we have with the Ad Council and the American Foundation for Suicide Prevention. And that's an example of one of the kinds of things that we do at Jed to help young people feel more comfortable talking to each other. We also, give presentations to young people and to parents and educators and things like that. And we have lots of resources on our website for all of those groups to learn how to talk with young people or with each other about mental health. So just a little bit about the landscape of mental health for young people in the US. And I think Micah also referenced one of these when he was talking. The Youth Risk Behavior Survey is a survey that's done of high school students across the US. And this is showing the trends in answers on the Youth Risk Behavior Survey. Basically, we're seeing, yes, that there is an increase in young people expressing feelings of sadness or hopelessness, expressing that they've considered attempting suicide, that they've made plans, that they have attempted suicide. So we're seeing, pretty significant trends in these areas. And I think it is important to look at, what's going on in the world that's affecting young people. Suicide is the second leading cause of death for young people ages 10 to 34. If you go down to the smaller age group of 15 to 24, it's the third leading cause of death. Generally, the first cause around these ages is accidents, and then after that, it's suicide and homicide. And so that's pretty alarming that's what we're seeing. In terms of some basic suicide stats, there are, firearms play a significant role. And that's, it's very important to talk about, sort of safe storage of firearms, making sure that they're inaccessible to people who are at high risk of suicide. Because over half of suicide deaths in the US involve firearms. Most suicide deaths are boys or men. And the groups with the highest rates of suicide include American Indian, Alaska Native young people. And then it's white youth. And then we're seeing some pretty alarming trends for other young people of color. So for example, Black youth have the fastest increasing rates. They don't have the highest rates right now, but their rates have doubled in the last 10 years. And especially for Black girls, there are some concerning numbers. Some additional data points: rural youth have about twice the rate of suicide compared with urban youth, and some of that has to do with access to guns, and then I think some of it is social isolation. And so LGBTQ youth, we know, have high rates of suicidal thoughts, suicide attempts, but we don't actually know the rates, because when we look at suicide rates, we're looking at the numbers coming into the CDC. And those numbers come together from basically coroner reports, medical examiner reports, and information on gender and sexuality generally isn't included in that. And also for young people or for anyone, it may not be known at the time of someone's death. The person might not have been out, for example. So with all of these kind of alarming trends, I wanted us to think a little bit about what can we do about this? And I think you're right that there's a ton we can do in terms of prevention. So these were a few of the things that I have been thinking about. One is connecting young people to community. So I don't know how many people saw the recent report and op-ed by the Surgeon General. He said that we're in an epidemic of loneliness in this country, and I think he's right. Some of the stats that he talked about, one was that the health impact of being socially disconnected is similar to smoking 15 cigarettes a day in terms of the impact on your health. And one trend that I saw that was especially concerning to me was that young people especially are losing time in person with friends at really significant rates. So if you look at about 20 years ago, so they looked at 2003, the amount of time that young people spent in person with friends was 2.5 hours a day. And now that's gone down 70% to 40 minutes a day. So young people are losing a lot of time that they had been spending with friends. And, I think we're social creatures. Humans need to be connected to other people. So we know from research that social isolation and loneliness predict depression and anxiety and suicidality. And we know the opposite is true, that if you are more connected, you are less likely to feel depressed and suicidal. So at Jed, we work with schools to help them create school communities where young people feel connected in. But this one is for parents. And I think, Micah and Sydney were talking a little bit about this earlier. Like, a lot of times young people don't necessarily want to go to their parents. And they're not the first person that a young person will go to. They might be testing the waters a bit with their parents while they talk to their peers, or maybe talk to a different adult. And so as parents, we want to help young people to find other people in their lives who they can connect with, especially other adults. So when you're thinking about how to support your kids, one of the best things you can do is help them from a young age to connect to other adults in their lives. So we want to make sure if they have aunts or uncles or someone in their life, in their family, that you think would be a good source of connection for them, that you're connecting them. If you have friends of yours that you think would be good role models, that kind of thing, that's the people that you want to connect them with, and encourage them to get involved and participate at school and get involved in clubs and things like that. It's all about connection. The other thing that I've been thinking a lot about is provider diversity, because I think a lot of times young people don't want to reach out for help when they don't think that help that they reach out for is actually going to be useful to them. And I think that's because a lot of times there's a disconnect between young people and what they think they're going to find in providers. And we know only about 4% of psychologists and only about 2% of psychiatrists, for example, are Black. And so for Black youth especially, it can be really hard to find someone to connect with. And that's true for a lot of different groups. So I think we need to figure out how to create pipelines for providers so that young people feel like there are people who see them and understand their backgrounds. And then the last thing that I've been thinking about most recently is trauma-based therapies. Many young people have been through significant trauma. That includes growing up in a society where they're facing discrimination and harassment. Maybe they're seeing people like them, on the other end of violence on TV, or they're seeing laws that people are trying to pass, that trample on their identities. And I think that it's important to address that trauma. And so there are a lot of different trauma-based therapies, but one of the ones that I think is most helpful is called dialectical behavior therapy. And that has a number of different sort of modalities to it, and it's a group-based therapy. And I think it can be super, super helpful. So if we're looking at, what we can do once someone is already in treatment, I think trauma-based therapies are going to be one of the answers. And then the last thing that I'll talk about is, how to start a conversation with a young person. And I think probably we're going to hear from Chase as well a little bit about this, but these are some of the things that I think about when I think about starting conversations with young people. One of them is talk early and often. So if you're in a young person's life starting when they're little, start talking about this stuff very early, bring up mental health, and you can do it in ways that are age appropriate. So for example, talking about emotions with a toddler or with a young child, you can say, let's think about, what are you feeling like right now? Are you feeling angry? Are you feeling sad? Try to identify the emotion and then help them to figure out, how to deal with that emotion. And I think that part of that is the next one, which is, be authentic. So that's coming to it with your own experiences and being real with young people, that you also go through really difficult times and have really hard emotions, and that you actually have coping skills that you have built and new ones that you're trying to form to help deal with it. So for example, if a young kid is feeling really upset about something, you might say, when I feel really upset, sometimes what I do is I get exercise and it really helps me. So do you want to, maybe we could go to the playground and you can run around and see if that helps you. So it's kind of helping young people to sort of figure out what identifying their emotions and figuring out what helps them. Maybe it's when I feel really sad, I call a friend or a family member. Do you want to call grandma right now and see if it'd be helpful to talk with her? That kind of thing, modeling, demonstrating your own coping skills. And then really listen. I think a lot of times as adults, we come to young people with ideas about what they might be going through. And it might, right? And I'm looking at Micah and Sydney, and it might not match what they're really going through. Maybe there's something that they're going through that has to do with a relationship with a friend or someone who they're interested in or something like that. And you don't actually know anything about it. And so it's leaving it open for them to talk about it and not just assuming, oh, it must be this thing that I already know about. It has to do with that test that they brought up last week or whatever it is. Just being open to hearing like what it actually is that's going on. And validate young people, don't gaslight them. So there is a lot going on in the world right now. Like there's a war in Europe that most of the world is now involved in. We have movements for racial justice in this country, climate change is happening. All of these things are real, and we can't tell young people, hey, just, go to school, do your test. We have to say, like, actually, this is a very overwhelming world that I live in too, and I understand why you would feel like it's a lot right now. And then the last one, which Micah brought up already, is it's okay to talk about suicide. And actually, you should bring it up if you're concerned, because research shows that, bringing up suicide, contrary to the myth that it would increase someone's likelihood of acting on it, it actually provides a sense of relief typically and leads to increased help-seeking behaviors. So this is just for anyone who's interested in finding out more. Our mental health resource center at Jed provides helpful information for young people, for educators, for parents to learn more about these topics and more about how to talk about them. And feel free to be in contact with us.
Thank you so much, Dr. Erickson-Schroth. That was really helpful context for us to have. And I suspect folks may have more questions, and I hope that you'll throw those into the chat for us. I'll also put the link to that mental health resource center in the chat. Please correct me if that's not the best place to send folks. But at this point, we've started by hearing a little bit about this personal dynamic. And I hope folks are thinking about what kinds of questions they might want to ask to individuals who have engaged in a conversation about mental health directly as a parent and as a teenager, to a psychologist who's been doing this work at a national scale, and also to Dr. McCullum, who's been doing this work for many years in a school setting. So I want to transition to hear from you a little bit, and I'm hoping that Dr. McCullum, you can just start us off by sharing a little bit of an overview of your experience in the K-12 education world, and specifically how you understand the school's role in shaping and supporting student mental health.
Okay, Mom. Thank y'all for inviting me, and this conversation has been excellent so far. I think it's so valuable. A lot of my work as a school psychologist, I initially came into the field as a school psych, and really just supporting students, teachers, administrators, parents with really just kind of understanding mental health in general, behavioral health, academic, how everything really aligns together to really support the whole child. So we as a school psych or a school-based mental health provider, we do all types of supports for students. So we can provide individual counseling, we provide group counseling, we provide resources to students who are in crisis. We conduct risk assessments for students. We make sure that if they need more intense supports or parents need those supports, we have access to those, and we create systems and structures that really allow students to recognize that it's safe. I think the communication piece is important. So y'all all talked about that we really want to make sure that we create a space where students feel safe, and that we train teachers and staff and parents and other students not to invalidate feelings and emotions. I think one of the major concerns, and one of the things that we really talk about when we train in schools or we provide supports, are really allowing space for effective communication, and also equipping students and families and teachers with the skills related to that communication that a lot of people don't have as much anymore. It's okay to talk about how you feel. It's okay to understand those feelings. It's okay to be sad or upset or mad or angry. So that's something that we have to really sometimes explicitly encourage students to do, because it's often kind of by nature of the way that schools are structured, we have to run on this type of schedule. We have to do this, or if you feel this way, well, we really don't have time to talk about that. Let's move on to the next thing. So we really have to kind of move to a space to where we can really teach people how to actively listen. One of the biggest issues that we face with when we are looking at student mental health, or even how we intervene with behavioral issues, internalizing or externalizing, is that we don't really listen and recognize and really see the relationships between thoughts, feelings, and our behaviors. So we work really hard to create systems, to hire people who have a mental health background in schools to be a present a voice to create. We have a multi-tiered system of support. So we do that for behavior and academics, and we do it for social emotional learning as well. So, how do we help students understand how to identify their emotions, how to identify emotions in others, how to develop strong relationships, and to problem solve when things don't really, go the way that they expected them to go in those situations, and who can they talk to when those things occur. So we provide a lot of different systems and structures, and we make sure that we consistently train our staff to really understand the value of focusing on the whole child. Because as an academic institution, we want to focus on, moving from one place to another academically, but if you're not really ready, and if a student's not in the place to learn, or if they've experienced a certain type of trauma, or if they're angry or upset, is learning going to actually occur? And there are ways to really support a student in a way that really just allows them to be heard, and it gives them power. We want to empower students to have a voice. We want to let them know that there is choice. We want to recognize that they're valuable, and that differences are good, and that feelings are okay. So that's, I don't know if I kind of would have a roundabout way of doing some of the things that we talk about, but really all the work that we do kind of falls into that category.
Oh, that's super helpful. And I'm wondering how many folks in this room are resonating with that challenge of wanting to and knowing that mental health needs to be prioritized with how do we fit this into the school day? So as somebody who has been, a lead school psychologist, a district level administrator in social emotional learning and whole child health, I'm really curious to hear more about these trainings that you do with folks who may not already have mental health backgrounds. What are some of those best practices and most important things that people can do when they're just starting to try to open up conversations with students who they're working with?
Well, one of the first things that we talk about is actively listening. So when you have a conversation with somebody, you want to be able to understand, to recognize that what is hearing a person, what is listening to a person, what is validating their feelings, and letting them understand that it's okay to feel, like I said, the way that you feel. So we talk about active listening. We talk about nonverbals. We talk about verbal, how we come off to people in different types of ways that we don't even we might even recognize that we're creating cultures and systems and feelings in individuals that we really don't want to create, because it negatively impacts their emotional health. So a lot of times we talk about active listening. We talk about ways that you can really understand what you can and can't control, because there's lots of variables in the world that an educator, there's some things that happen to students that we don't have control over, but we can create spaces that will allow them to feel safe, that will allow them to be heard. So what can you do in the space that you're in? If you have 90 minutes in a math class, how can you make a student feel that they belong? How can you create a space that they can, have a voice or be heard, and do that in a way that they know that Well, one thing we talk about is safe spaces in the classroom. So you want to make sure that you give students opportunities if they're feeling an emotion to deal with that emotion. I train teachers all the time that emotions and feelings don't just go away because we say we don't have time to do that. The emotion is still there. So how does a student address an emotion and cope in a way that is a healthier way to cope? And often that has to be taught. We explicitly teach some of these skills, and there's a way that we can teach and reinforce making choices that really allow us to feel our feelings, express our emotions, and really get ourselves in a place that we're ready to learn. And we kind of frame it around that. And we frame it in the, one of the things that I really focus on is looking at the whole child, the whole person, that kids are not different than, I mean, they're different, but everybody's got feelings. Even a 3-year-old has a lot of feelings. They have a lot of emotion. They perceive things, they hear things, they interpret it a certain way. So recognizing that is actually really important. So the more we understand behavior, we understand that behavior is learned, that we understand how to communicate effectively, the more that we'll be able to have students share their concerns, be open about them, and allow us to have open and honest conversations.
Thank you so much. Yeah, and I really appreciate you both, Dr. McCullum and Dr. Erickson-Schroth, taking us to the younger students as well. We are talking about youth mental health. We're talking in particular about teen mental health today. But I know, Micah and Sydney, that your podcast does speak with some experts who are talking about this as a crisis that's worsening at younger and younger grade levels, and is something that we need to be aware of for students across the board. So really grateful to you bringing that to the fore and like what we can do at different levels. And I want to ask you one final question before we transition to the questions that our audience might have for you all today. As you talk about building those safe spaces and the importance of students feeling welcome in their environments of learning in order to be able to learn in the first place, can you talk a little bit more about your experiences with creating that kind of school culture? Whether you're an administrator or an educator, what are the necessary things that have to be in place for students to have that kind of school culture where mental health can be prioritized in the first place?
Well, I think the big thing that we have to really, when we re-envision schools to focus on that whole child or really address mental health and social emotional learning in schools, is really allowing the time for that to happen. So it does take time, and having the staff there. So we talked about that a little bit earlier, is that you have to have people in place who understands students' needs, who understand students' emotions and mental health, that can really guide, be a sounding board for staff as well as students, and really kind of guide that process. So allowing the time and the space to do that, and having the staff that can really support schools and students, teachers, and families at addressing these, and systems. I think because schools have so many different things happening all the time, we have to really develop systems that can teach staff members how to conduct a risk assessment, or who needs to participate in that process. Or if a student shares a concern with you, these are the steps or people that you need to go to address that particular issue. So really be able to create systems that are easily understood, show the importance of this related to student outcomes, and really design the learning environment to really focus. I keep saying the whole child piece, but learning is holistic. That's a person needs all of those pieces to be whole. And I think the more I talk to teachers about that, or the more we talk to teachers about that, the more they understand, and they'll take that time to build those systems, to follow those procedures, to listen, and to develop certain types of interventions or resources or tools that we have in place within our school systems to make this happen.
Thank you so much for that. There's so much good advice and so much that's actionable here. I appreciate you all so much. And I want to turn things over to our participants for the questions that you have. And right now there's a question from Tobias in the Q&A that I think could be for anyone who wants to respond. So I'll leave that open, whoever's feeling it first. Tobias is asking, how can we better break through cultural and generational stigmas around mental health issues and treatment? So any thoughts on breaking stigma around mental health?
I'll jump in just for a second. For me, I'm in my 50s, and I think one of the people we spoke with said that my generation didn't believe there was anything you could do if somebody was suicidal. And that's a big myth. And so, now becoming aware that there's a lot you can do. I think one can sort of address these stigmas that keep us from even trying or make us afraid to try or make us anxious to try. So I think that's at least one thing you could do.
I can jump in here too. I think the most important thing is figuring out what are those things. And I think traditional stigma doesn't necessarily explain it all, especially for younger generations. I think it's becoming less and less of an issue to talk openly about having certain mental health conditions and things like that. But there are still barriers, even if they're not traditional stigma, that get in the way of people seeking out care or reaching out for help. And they might not be, necessarily what another person would think of. So I think, number one is research. And that's one of the things that we do at Jed. We actually have a research study going on right now where we're looking at barriers to care for young people in different groups. And it really does depend on where they're from and, what kind of background they're coming from. For example, a lot of young people in immigrant families, one of the biggest barriers is not wanting to burden their parents with yet another thing. And that's not necessarily a universal barrier because there are a lot of young people who would feel okay about bringing something to their parents and wouldn't feel like it's an extra burden because their parents might not be dealing with as many things already. So I think that that's where we start.
Thank you folks so much. And I want to go to a question from Letitia in the Q&A here. Letitia's asking, what resources are available to facilitate or initiate a mental health conversation with teenagers? And I might broaden that given our participants for any age group, but we have our listening guide for conversations with Sydney at the Pulitzer Center, but that resource is for educators to facilitate self-reflection and prepare to have these kinds of conversations. It's not necessarily a facilitation guide. So anything that you folks would recommend to folks who are looking to have those conversations as additional resources they might add?
Oh, go ahead, Chase.
I was going to say, I know I don't want to talk about, there's different types of programs that can talk about mental health in schools, but I think somebody mentioned in the chat, mental health first aid. So there's different things that schools and districts can really kind of bring in and really help facilitate those conversations among the adults and kind of model some of those types of things and really take some of the stigma and really just foster vulnerability and openness within those types of environments. So I think you can look up how to have crucial conversations about different types of topics. So look at, or even just how to have general conversations. That's one of the things I train people on is how do we have general conversations or even talk about empathy? So I think there's different resources about empathy, about how to actively listen to someone and just really even take time. Those are some basic level steps if you want to really get started. But there are some programs, like I said, mental health first aid that could be beneficial when we're really focusing on that mental health piece.
I'll add that on the Jed website in the Mental Health Resource Center, we have a lot of information for parents, especially with young people who are transitioning, like from high school to college, for example, and it has links out to other resources as well. So feel free to check there and you'll be able to see other resources for parents.
Awesome. Thank you folks so much, and definitely welcome you to share in the chat or to share with us afterward, and we can email those links out to folks who are here today as well. And we have a question for Sydney from Meg. Meg would like to know how making this podcast has impacted your own mental health journey, maybe in ways that you weren't expecting?
I think so. Actually, before we started the podcast, my first therapist wasn't too helpful just for my own journey. It just wasn't the right fit for me. And I had sort of been left with the impression that therapy wasn't really for me, honestly. I had heard from a lot of people that it's like, oh, go to therapy, it's great. But my first experience wasn't all that successful. But then after we started the podcast, I sort of realized that I should give it another shot. And as I learned more about it, I sort of was more insistent with my parents of just like, hey, we started looking for a therapist who would actually be a better fit for me. And we've found one. But yeah, it really inspired me to actually tackle my own journey, I guess. And also just having the security of knowing that I can help my friends in ways that are that can actually work. I think that makes me feel a lot more secure just in my daily life, because I have had a number of friends who I've tried to help with their mental health journey in ways that either were or weren't beneficial for both me and my friend. But yeah, I think it makes me more secure, honestly.
Can I just throw in one other thing up with that, which is, I think I'm very, very aware that Sydney's mental health is also dependent on the mental health of our community. We had a child die by suicide a couple months ago, and it really had a huge impact on the community. And I know from my reading that increases the likelihood that other people will die by suicide. And so I think, as a parent, it's easy just to get focused on your own children, and sort of forget that our kids are part of a much larger community, and the health of our kids is dependent on the health of that community. And even if we're not talking to our kids are talking about suicide with each other. And so that's a conversation that, I think one of the things that became clear is that, Sydney doesn't have the resources to help other people on their own, right? But there are resources out there. And, I think one of the suicide prevention workshops we went to gave us a little card and, really suggested that when somebody, one of the best things that a kid can do for another kid is to guide them towards an adult who can help them. A trusted adult is the language they used.
And not to be a therapy friend, because you can't try to take someone else's problems on your own shoulders.
Yeah, so I think there's a lot to learn from that for me, at least.
And actually, I would add, Micah, into what you said. It is important to bring up that when someone dies by suicide, there can be an increase, in the community, but that is, something you can mitigate significantly by, taking action right away. So there's something called postvention that we do with a lot of schools that we work with. If there's something that occurs at a school, the way the school reacts and the way the community reacts can really affect any likelihood that there, are additional suicides after that. And I think a lot of people think that it's very common for there to be clusters of suicides, but it's actually a small percentage of suicides that are in clusters. And there's a lot you can do to kind of mitigate the likelihood that will happen by having a good postvention plan and making sure that young people feel really supported in that time afterwards.
That'd be a great topic for a podcast.
For an episode, yeah, we should definitely.
Postvention.
Folks, thank you so much. And yes, there is a lot to learn from what Sydney shared. And I think just the description of this as a mental health journey in and of itself is wise and a reminder of the learning process that all of us are undergoing by being here today, and that all of your work is pushing forward though. So thank you for doing what you're doing. And folks, I know we're a little bit over time now. Want to be respectful of that while also being respectful of what Dr. McCullum has reminded us of, that we need to take time for mental health. So I just want to throw it to everyone for any final thought, final word that you want to share before we close out. And Dr. McCullum, we can start with you if that's all right.
Hey, sorry, I'm on my phone, but I think the main thing is communication and connection. That's everything that we need as far as supporting students with mental health, is connecting with them, letting them know that it's okay to be vulnerable, and don't invalidate students and their out and how they feel. That's something that I see constantly, and we don't know that we're doing it. But I think connection, communication, and really systems of support for mental health is everything.
Thank you so much. Dr. Erickson-Schroth.
I'll echo all of that and say that conversations. I love that your podcast is called that, conversations, because that's the most important thing, I think, is being able to talk about this stuff.
Thank you. Pass to Micah and then Sydney to close us out.
Oh, sorry. I can just say having these conversations has, I think, brought us closer together and increased the kinds of things that we can talk about, and what could be more important.
We hope it helps other people as well.
Thank you folks so much for being with us. Grateful for your time and grateful to all of you for the really important questions and the work that you're doing to hold these conversations yourselves in your homes, in your communities, in your schools. So thank you all. We are wishing you a wonderful evening, and we will be in touch with some follow-up resources as well. Take care, everybody.
Thank you.
Thank you, everybody.